Love Great Expectations Realty, doing so many great things in Hastings. I mean, we have Jenna in all the time talking about all the latest and greatest, and that cheese shop that you've been talking about.
Oh my God, I can't wait. I'm waiting for Jenna to let me know when it's open. Because there's so many things with Hastings Main Street. I haven't had the opportunity yet to go and check it out.
I'm so excited for you, especially this holiday season, to support our incredible community of Hastings.
So excited.
And support our incredible title sponsor, which is the Bailey Group. This is a really, really great conversation. I'm excited that Tammy is in studio. It's open enrollment season. That's critical window when individual families and business owners make some of the most important choices about their health care and the year ahead. Navigating plans, premiums, and the benefits can feel overwhelming, especially what's going on in the media right now. There's a lot of fear and confusion. That's why today we are joined by Tammy Morabito, who's here to help us unpack what open enrollment really means, what's new this year, and how some of these misconceptions can be solved with using the incredible resource of the Bailey Group. Tammy, welcome back to Sunny TV.
Howdy.
So excited to have you here because guess what? I have a lot of questions.
Yeah, and here we go with the wild ride, right? So unpack this, give us the TLDR. What are they saying on the streets? What's going on right now with healthcare?
So it is open enrollment. So that's the big news, is everybody's on a deadline, so they're trying to figure out when do I have to make a decision. The big news is there's a lot of increases. Overall, every carrier.
Like $5-10, or are we talking hundreds of thousands?
If you get a $5 or $10, you need to play the lottery. Let's just put it that way. It's definitely not 5, 10. There are some that are very fortunate, but there's a lot of huge increases. We're seeing up to minimum 30% increases, which is huge.
Yeah.
I will say in the 15 years that I've been at the Bailey Group, on the individual side, this is probably the biggest increase year that I've seen. Of course, people want to know why, and there's no real answer to the why. There's a lot of answers to the why, I should say. The main thing is if you are not eligible for a subsidy, it's pretty bad. Okay. So if somebody is not in the threshold or the guidelines of the federal poverty level, which we can share later, but that is the big issue, is people are paying almost another mortgage payment. This is getting out of control. The Affordable Care Act is not affordable. We know that, and the only way to qualify is to be in those guidelines to help offset those increases. And even the subsidies, everybody thinks the subsidies are going away. The subsidies are not going away. Do y'all hear me in there?
Okay.
Just so you know.
Okay.
The subsidies are and have been since the inception of the Affordable Care Act, which started in 2010, is when it was signed. It went into effect in 2014.
Which made it affordable. Am I saying that right?
Well, it made it affordable to an extent. Even then, it was still, health insurance has always been expensive. The offsetting of the subsidy helped offset, which basically was a tax subsidy. They were basically saying if you make between a certain dollar figure and a certain dollar figure in that upcoming year, they were going to give you money to, help pay for your premium.
Okay.
Those are still in effect as long as you were in those guidelines. So what happened a few years back in 21, there was what's called the American Rescue Act. Government likes to always reinvent the wheel. So the American Rescue Act, which people will remember when I say $1.2 trillion, was signed into that law during that administration, and a portion of that money went to extend the subsidies. So the extension of subsidies is what they're arguing about right now. And what that is so like for a single person, you have the guidelines. If you are over, I'm going to just say 60,000 because it's an exact number.
I have it here in front of me. 62,600.
62,600. So if you are over that number as a single person, you do not qualify for a subsidy, and you never would have with the original Affordable Care Act.
Okay.
When the American Rescue Act came in, which again that year is very important because that was when the pandemic was happening, and nobody, work was slow. People were slowly going back into the workforce, but that's that money that was extended over those guidelines.
So that's maybe going away.
That is going away right now. Okay, I'm going to tell you this week I haven't even had a chance to read what they signed, and we know it was official, I guess, yesterday. But that extension was the argument with the Democrats and Republicans on extending it for a lifetime, putting an extra 5 years on it. Republicans want to fix the actual pig in the room, which I think everybody does. It's the health insurance price, period.
Yeah.
I mean, we shouldn't have to have an Affordable Care Act. It should be affordable anyways.
Okay, I
But
love that. Yeah.
long story short is the extension is what is gone as of December 31st.
Okay.
So it was in for a few years, and of course we knew it was happening. But
Is
now,
that why I'm seeing people in the blogs crying about, oh my
Yes.
gosh, my policy is now $1,300. It was
Yes.
$100 or something.
Yes.
Okay, so then what do you do with people like that? Do you remix it
Yeah.
and find a different plan? Like,
Well, we definitely try to have to find another plan that's affordable for them. But the problem is, if they're not getting a subsidy, none of them are going to be affordable.
Right.
And of course, the older that you are, the more costly your premium is. I mean, I've delivered when I'm not even joking, like I am gray on one side, the other side will fill in this year. But I mean, I have delivered $2,000 increases,
wow.
which is insane. So it is, there's no solution right now. We are hoping that,
Do you ask for a decrease in pay? I mean, could
pretty
you do that?
So let's say this. It's sad to say that if you make less money, you'll get help.
Right.
So what I have said, and I've been very upfront about it, is the message is not clear. And if we're trying to say we want to be working Americans everybody wants to make more money. But now if you make more money, you're not going to get help from the government to help pay for health insurance that you possibly need. You don't need to have insurance. Some people are like, well, I don't need it. Am I going to get penalized? No, that's gone away a long time ago. There is no mandate for you to have it. But we all know that one life event, which we cannot predict.
Correct.
And I say it to all my clients all the time. Insurance, the definition is it's a risk you take. If you don't have it and something happens,
You are SOL.
That's like,
you are SOL.
for instance, when Brian and I's apartment burnt down, I had canceled my renter's insurance. I had it for years, never needed it. Canceled it the month before,
God,
and my
Melanie.
apartment burnt down.
Yep.
And I was like, lesson learned.
Yeah.
So now let me ask you this: in your mind, like, do you, with all of your experience doing what you do you see at some point things getting better with this?
So
Organized, at
I would
least?
say yes. I pray a lot. I do believe that, without getting political, I do believe the current administration and the last administration, everybody's touching it.
Okay.
But the problem is we have a very separate government system that they all need to like the shutdown, of course, is not going to solve anything, but they really do need to get their minds
I have an idea they
together.
could do. What if we take them
Out of the situation.
and put them in a situation that regular people deal
Yes.
with their age groups?
I say all the
have
time,
to live off what regular people live off of, and let's see if they can do it. That, I think, would be the biggest game changer.
I honestly think, I'm not a protester. I don't have time for that anyways. But I would say that if all the agents that deal with this on a daily basis would march with me anywhere,
Yeah.
and we could probably say, hey, let me just show you how this looks for the average American. I'm not saying that somebody that makes, even, people joke because it's like, oh, well, somebody that makes $100,000 should be able to afford a $1,200 premium. That's insanity.
That's insanity.
Like, let's do the math.
Yeah.
You know what I mean? If you are
With everything
six
else,
figures
yeah.
is not,
It's-
living today.
That used to be the thing, the
Right,
carrot to run
right.
after, and that is not a quality of
Right,
life, really, truly.
right.
It puts you in a bracket that
we
you can't
need
afford.
to make it affordable, and again, I could go a whole other 3-hour show with you
it's a
guys
deep
on
conversation,
It is
so I
a very
appreciate
deep
it. Yeah.
conversation,
So now
and
let me ask-
this is why I have a job.
Yeah.
But at the same time, I joke, last year probably was the first year I cried during open enrollment, and I think I've done it a few times this year too, because it's like, I'm a fixer.
Yeah.
There's no fix
can't
for
fix
this.
it.
I can't fix this.
So
So
now-
we just try to navigate and guide our clients. I'm making a choice. Unfortunately, sometimes, like if they're on a Florida Blue options plan, it's a PPO. It's one of the largest, networks. But that may not be the solution this year. You may have to say, listen, I can't continue to see those doctors that take that. Mayo is a big, specialty hospital, and people love Mayo, and that's the plan they take. But at the same time, as you're paying twice as much to go there.
So now, since you just said PPO, okay, because
Yep.
these acronyms confuse me.
Yeah.
Break down for all the viewers, because they might know, but I don't know. Maybe some of you don't know.
No, it's a good question.
Yeah.
Break down the difference between PPO, HMO, QPRX, XYZ, all the
ABC.
Yeah.
Yes.
Yep. So
Break it down.
PPO is the preferred organization network. You know, like basically when you see a PPO, it is in and out of network, meaning that you can go to doctors that are in contract and out of contract, and you still are going to get services.
Okay.
It is the bigger, more expensive
Right.
plans. So like when we say this one is a PPO, usually we still search for your doctors to make sure, but they're probably in it. Okay. HMO is, think of in your state.
Okay.
So
That's what I have.
Yes.
Florida healthcare.
Yeah. You
Yes.
have Florida Healthcare, which is the carrier, but you have an HMO.
Right.
So the HMO.
Stay here.
Home. Think of H home.
Okay.
Okay.
What do the letters actually stand for?
So
Home.
is you're gonna hit
The
me on
land.
this. Yeah. HMO is Health Managed Organization, and PPO is Preferred Provider Organization.
Okay.
And
Got
I'm
it.
not even going to go, but then there's EPO and
What's
POS.
that mean?
You're really drilling me today.
Yeah.
EPO, don't ask me, but I can't remember. But I will tell you what it is. The easy way is think of a PPO downgraded,
Okay.
Okay.
where they don't have the same contracts. There's going to be less. There's going to be more, not stipulations, but you're going to have like almost half the network.
But you can travel to Georgia and
You
be
can
okay.
still use the plan outside.
That's
We've,
right,
talked-
that's
we've
how I-
talked about this.
You in Georgia.
Yeah.
I'm just saying, like that's how I know. Like, yeah, you can go a little bit.
Everywhere.
Yeah.
Well, like HMO, so HMO, there are some HMOs, just, you know, this is where it gets confusing because they're like, well, it's an HMO, but it says POS too. Oh,
What
yeah.
the heck is that?
I'm telling you, ABCs. So the HMO and the POS, what that means is in the state, you have a network, which is the home HMO, remember?
Okay.
POS says, okay, well, we're going to add some out of network. Yeah, don't say what it really
Yeah.
POS means that you have out-of-network benefits like outside the state too. So it doesn't mean like if you go to Dr. George in Georgia,
Okay.
he's not in contract with that HMO. So you're going to pay whatever the contracted rate is or his.
Correct. Okay. Maybe
it's
he's a
out of
specialist or
network,
something.
right.
Okay. Okay.
But on an HMO, you have emergency coverage anywhere in the nation.
So I have a question. Insurance world, can we like make this a whole lot easier? There's like
Well, that's what she's praying
this,
for,
this
child.
whole
I mean,
thing,
that's
and,
what
like,
she's doing.
HMOs, the PPOs, the EQX or what
Wait
Esquire,
till you
whatever
get
it
to
is.
Medicare, and it gets 10 times.
All I know
more
is thank
confusing.
God for people like the Bailey Group, where we all, Tammy and your crew, you
Yeah.
guys know what you're talking
Sandra,
about.
everybody, yeah.
Yeah, Sandra actually just helped my husband and I.
Oh, good.
And I'll tell you, she was awesome. She called both of our physicians' offices, primary cares, and yep, good to go. And it took her less than 24 hours, and she had it all wrapped up in a pretty bow. And
Yep.
so,
So
That's
a
what we
lot of
do.
people stick with the same plan year after year.
Yes.
Is that the smart thing to do, or is it time to start really opening up and start looking at more efficiencies
It's
within your?
always, you know, so like I spoke to a prospect the other day who is a family of 4, and they have certain situations with their children that need extra coverage possibly this year. So of course, knowing those events are going to be taking place, you kind of look at what you have and say, okay, well, I have this, and I'm going to pay XYZ dollars if I have this service. But if I pay a little more than I really want to in premium, I'm going to get a better plan with lower out-of-pocket risk. So
Okay.
I literally will sit there with people and we'll calculate the premium on an annual basis and then what their co-pays and out-of-pocket risk is, so they can see the true picture of the hit. I call it the hit by the bus syndrome. If you get hit by the bus, you know you're paying the premium all year, but your out-of-pocket max is this.
So then, what's deductible?
So deductible, we're really going to education today. Okay,
Yeah.
so you have deductible, co-insurance, out-of-pocket, and then you also have co-pays.
Okay.
Okay. So when you see on your summary of benefits,
$2,500 deductible.
right? So you have a $2,500 deductible, and you probably have maybe 20 or 50% co-insurance, but then your
2,500, that's
out-of-pocket, let's just say, is
No, it's not
5,000. Okay.
Yeah.
Okay.
Okay, got it.
That's not your plan. I know your plan. Your
Oh.
plan's not that. We're not going to talk about your plan because you're going to get everybody jealous in the room. But anyways.
Sorry.
We're going to just say 25,000 is a deductible, say 50% co-insurance, and 5,000 out of pocket.
Yeah.
But you also have co-pays maybe for the doctor and maybe for urgent care. But then, like, if you end up in the ER or inpatient, you have to hit deductible.
Got it. Okay.
So I'll give an example. Again, 25,000, 50%, 5,000 out of pocket, co-pays here and there. You go to the doctor, you pay $25. That's all you pay. You go to the specialist, you pay $50. That's it. No, the word deductible did not come out of my mouth.
True story.
Okay. Now you go to the hospital for a service, either inpatient, outpatient, or whatever. That's going to go towards that $2,500 first. So if you go and let's just say the contracted rate between that doctor and hospital is $5,000. Just throw in a number.
Okay.
You're going to pay the first $2,500. Okay, so you've satisfied your deductible.
Okay.
And you still have $2,500 left, right? Because it was a $5,000 bill.
Right.
You have 50% co-insurance of the remaining $2,500, which is
2,500.
what's 50% of 2,500? 1,250.
1,000. Yeah, 250. Yeah.
Right. So now you're paying
Notice how I didn't answer.
25.
I'm not good at math.
Yeah, 2,500 plus 1,250
Got it.
is your cost
What genius came up with
for a
this?
$5,000 bill.
Okay.
And you still haven't reached your $5,000 out of pocket.
Okay.
Guys,
So
this
just-
is why you need to wear
wait,
a helmet.
so-
You do not
No,
need to
this is
fall
why
off.
I have a job. Call the Bailey
Wait,
Group.
so Tammy, to do your job,
Right.
you have to not only have certifications and credentials, but you also have to have a degree in like AP calculus.
Well, I'm
Is what
going
you're
to
telling
say,
me?
when I sat in algebra class and they were like X plus Y equals Z,
You're like,
I
I'm
was
not gonna
yeah,
need
no,
this.
I'm not
Now
gonna
you do it every day.
Yeah, pretty much.
She's got her graphing calculator, her TI-85, Texas Instruments.
So I will say that this is why I'm going to say for the 15 years I've worked at the Bailey Group, the one thing that I can say we stand out is our service.
Oh, 175%.
I can definitely send you to a link and you can look at it and you can play all night, which I tell you, don't do that.
No, don't.
But if you call us, we are very busy at this time of year. We ask for everybody's patience, but we will get back to you.
What's a good email address to get a hold of you?
So mine is T and then my last name, Morabito, which I'm hoping y'all are going to throw it on there at mbaileygroup.com.
Perfect.
So-
And that is honestly the secret right now for you to get a
Right
hold
now, I will tell you multitasking. I'm getting text messages at my work line, which you can text me on my work line, 904, what is my number, 4612115. You could call the office at our main line. You could do however you're going to get us. We are multitasking. I am working late nights where at night you may get a text from me if I know I'm allowed to text you at 10 o'clock saying, hey, you're all good, or I need this info. We will send links to your email address. We'll respond. We'll get to you somehow.
It's amazing.
We used to have a 24 to 48 hour turnaround, and I will say I had to change my voicemail because that is not happening this
Yeah.
year.
Okay,
So
but still-
patience is a virtue. At
Still
this point.
amazing and still
Yes.
such a great service. And I think a lot of people have a fear that it's going to cost them to work with the Bailey Group. Can you clear that up?
Yeah, no fee. If any agent ever charges you, you need to run the other way because that is illegal.
Okay.
Oh.
So do not work with an agent that's going to charge you for their services. The biggest compliment, because a lot of people are like, oh, you took so much time and we're still not buying anything. What can we do? Just refer us out.
Yeah.
I mean, that's the biggest compliment. Just like with any realtor, it's the same thing. You know my name.
Yeah.
Say my name.
Say my name.
Listen, I will
So-
tell you, if it wasn't because listen, I tried to look things up on my own, and after the 5 minutes, I'm like, I don't understand this crap. Where's Sandra's card?
Yeah.
Yep.
And I'll tell you, you guys, I can't stress it enough. Like the Bailey Group is where to go. The staff is amazing. Like you tell them what you
Truly.
need, and they will search it for you. You don't need to know how to do calculus.
Absolutely.
They will send you the stuff. And what she did was the first set of stuff. I was like, oh, and then she sent me another round. But she's like, okay, I'm only attaching what I think is going to be best for you guys.
Right.
So
Yeah.
it was only looking at 3 things.
Yeah.
It's very important to, and I'm not saying, obviously everybody should, you listen to your client's needs. But at the same time, everybody wants the best plan and pay the less. Well, unfortunately, that's not realistic. So we explain, again, when you understand your benefits, you understand the risk you're taking at the cost that you're having. I mean, we kind of talked, you said about your, apartment or whatever burning down. Same thing with car insurance. We don't sell car insurance, but it's like when you buy your car insurance, you should shop that every time it renews. But the day you increase your deductible to $1,000, you may have to pay that
Yeah.
if you get in a car accident.
Absolutely.
Oh my
Yeah.
God.
So you gotta look at what's best for you and your family at the time. The one thing I do want to point out is open enrollment is in full effect for everything: marketplace, off market, and Medicare.
Okay.
Medicare right now, October 15th through December 7th is the last day. There's a lot of changes there. Very important to know medications and providers when you're trying to shop a Medicare plan. We can have a whole session on just Medicare too, but open enrollment for Marketplace, December 15th is the deadline to get your January 1 effective date, and then we're thinking they're still going to extend it for a February 1st if you get in by January 15th.
Awesome.
So, we'll be here for a while, and that's pretty much it. I mean, we're working round the clock. Sandra's new to our team, and she's rocking it. So you guys, I think, are talking to her next month, and hopefully she's still smiling pretty. And
Absolutely. That's my Sandra.
She loves it. But we're busy. The other thing is make sure that if you do anything online, I'll say this by yourself, if you do not use an agent, be prepared. If you give your name and phone number out, your phone is going to be, you're going to be harassed.
Yeah, I made that
So,
mistake, remember?
Don't
Yeah.
ever put
Yeah.
your number in there.
Yeah.
So, such a great chat, Tammy. Thank you so much for your time
Thank you.
today. This is really definitely the resource that we need in town. And
Thank you.
again, we'll put contact in comments for everybody to
Beautiful.
reach out to you. You're
Thank
amazing.
you so much.
Thank
Again,
you.
thanks.
Friends, we're going to pivot over to Maritime Creative and Flashes and Brilliance.